My doctor is actually a cardiologist, which falls into the internal medicine category. Well, I think it's a great opportunity for first years, right after their first year, to kind of get their hands dirty, just kind of jump into medicine, because I feel like it's the best way to learn. Even in school, when we do societies and we go and see actual patients in the hospital, I love the patient exposure, and I think that's the best way to kind of integrate what we've learned in the classroom to, you know, the actual patient setting.
You have great pulse. Did you take your Lasix today?
No.
Oh my goodness, you have to take that Lasix.
Oh, I know.
I would definitely do this again if I had the chance, because I think I've just learned so much in such a short period of time, and it's definitely improved my confidence with patients. And I think it's helped me to integrate the stuff that I learned last year and first year that I kind of learned for the test and then forgot. I think this is a great way to understand why we learned it in the first place, because it doesn't really make sense learning it on paper and taking a test unless you have a patient to kind of use to implement it.
What haven't I learned? I want to be a rural health doc. My grandfather had a stroke, and it took him 45 minutes to get to the hospital. The nurse couldn't triage him properly, so he coded in the waiting room, and they had one doctor on call. It took the doctor another 40 minutes to get to the hospital, and unfortunately there was too much brain damage, and he passed away. So I think it's really important to kind of improve our healthcare, especially in rural communities.
Knock, knock, knock.
See you later.
Hello. All right, so we got a gooey belly button, is that right?
This morning I noticed that you smell funny, and then I just thought she needed that.
I'm going to have Jenny start to do a quick little exam there, and then I'll look at it too.
One of my favorite parts of the program has been being able to learn firsthand what the patients are doing and saying, and being able to chart and take notes, and actually being an active part of that diagnostic process. I think it's really fun. It's really exciting. Dr. Hinton has been a really amazing teacher. He's taught me how to do the exam on different ages. He's taught me what to expect as far as shots and different behavior and patterns that you see at different ages. And the whole development process is really special.
I was attracted to this program because it's something that I've never considered before. You know, I always thought I was going to work in a city or like in the suburbs, so it was something different. And it's a lot more personalized because it's one-on-one with you and the doctor, so they can give you feedback, and then you really definitely learn how to talk to patients and do interviews and physicals and things like that. Here it's more of chronic. You see diabetes, cholesterol, hypertension.
All right, so you're here to follow up on your cholesterol? And you're on simvastatin, 10 milligrams? Do you have any like muscle aches?
I see like 5 or 6 patients a day, so I have a lot of practice with, you know, interviewing them and then giving a report to Dr. Rheinfelder.
Your last labs were this month from Monday.
The block we just finished was DMH, digestion, metabolism, hormones, and we had learned about like one particular disease, and I actually saw it in the clinic, so it was very relevant to me because we just learned about it, so I was able to apply what I knew to like an actual case.
Here she is with less than a week left, and she's actually writing clinical notes now that are equivalent to third-year student notes at the end of their third year. So she has progressed amazingly. She is already a step ahead of where many third-year students are. That would be great, thank you.
I have a question regarding like
So slowly over the last several weeks, she's become more and more organized. She's critically thinking about patient care and how to best treat the patient. She's coming up with good assessments and plans. Medication for breast cancer.
Students who go through this program absolutely have an advantage over their peers that don't do a program like this. First off, they get a wealth of clinical experience. For example, my current student, she has done dozens upon dozens upon dozens of medical histories, physical exams. She has seen me work in the hospital, she's been right there, she's seen me here in the office. She has a wealth of clinical experience that other students just have not gotten yet. I've seen her grow quite a bit during the time she's been here this summer. She's going to go back well prepared compared with her peers to do well in medical school, and will have seen a lot of diseases that will then help her as she learns about those diseases in her second year of medical school. She'll say, oh, I've seen that before, and it will provide a place in her mind to be able to remember those things and learn more effectively than she would otherwise.
Making a decision to participate in the program doesn't mean that you have to go into a rural program. It doesn't do anything except give you more experience and more information, and that's always a good thing.
But the rewards are very significant. You get a chance to establish a very important mentoring relationship with a physician who cares, who enjoys having you there. Most of us don't have students around all the time, so you're working with somebody who is enjoying this process, who wants to do it. And it's a lot of fun. Just a lot of fun doing RHPP.
If I had the opportunity, I would definitely do the Rural Health Professions program again. I think it's really helped prepare me for residency and third year and fourth year clerkships. I think learning firsthand at the bedside is amazing.